My name is Wendy Adamba. I work for Population Services Kenya, implementing the HIV self-testing in private sector project. We work with pharmacies, and the biggest role for them is to be able to talk to clients on the various types of HIV/ST kits and how to use them. The biggest role for pharmacies is to be able to talk to clients about HIV self-testing kits, walk them through the various types of HIV/ST kits and how they work, but also introduce other self-care products such as condoms, such as contraception. And the pharmacies have been very instrumental because they have given us data, so we are able to have visibility of how the HIV/ST kits and other self-care products are performing. And again, the other exciting bit has been the product bundling, that is selling the HIV/ST kits together with other self-care products. For us, at the end of the day, is to be able to grow the public health impact of the clients that are coming into the pharmacies.
Hola, soy Marta Arroyo, directora ejecutiva de Profamilia. Uno de los grandes desafíos que hemos tenido como organización que presta servicios de salud sexual y salud reproductiva, incluido el de aborto, es el de llevar la atención de aborto con medicamentos al hogar de las personas. Es así como en el 2021 diseñamos la herramienta MIA, kit que contiene todos los insumos e instrucciones necesarias para que la persona pueda acceder a un aborto seguro, autogestionado entre la semana 10 y 12 de gestación, de acuerdo a las guías de la OMS, en la intimidad del lugar que ella defina y apoyada a través de la telemedicina. Grandes logros. Desde que salió al aire en el 2021, más de 5.000 atenciones de abortos seguros prestados, llegando incluso a zonas remotas y distantes del país, ampliando de manera concreta la garantía del acceso a un aborto seguro, oportuno, libre de estigmas en Colombia.
¿Sabías que el aborto autogestionado no es solo una cuestión de empoderamiento individual? Es también un camino hacia la cobertura universal en salud. Voz Feminista ha apoyado diversos modelos de autocuidado para la práctica del aborto seguro en distintos contextos legales, incluyendo aborto con medicamentos en servicios de salud, aborto con medicamentos a través de la telemedicina, consejería en reducción de daños para evitar abortos inseguros, presencial o a través de plataformas digitales, y orientación sobre aborto seguro por parte de acompañantes capacitadas. El aborto autogestionado empodera a las mujeres y otras personas con capacidad de gestar. La clave está en la información completa y precisa sobre todo el proceso y la disponibilidad de servicios de calidad cuando sea necesario. A pesar de nuestros avances, todavía nos enfrentamos a desafíos para cambiar marcos jurídicos, ampliar el acceso, garantizar la seguridad, involucrar a más profesionales de salud y llegar a las poblaciones más vulnerables. La reciente transformación que llevó a la creación de Voz Feminista como alianza global nos brinda la oportunidad de trabajar colectivamente y co-crear soluciones con organizaciones socias en los 5 continentes. Juntas avanzamos en modelos de autocuidado para la práctica del aborto que ponen el poder en las manos de las personas y garantizan la salud, los derechos y la justicia para todos.
My name is Hawa Usman from Pathfinder International. Pathfinder's self-care activities started in 2019 with policy advocacy for DMPA-SC self-injection to create an enabling environment for introduction and scale-up of the intervention. Pathfinder International, along with other partners, is part of the National Self-Care Network that is supporting the Federal Ministry of Health in its commitment to the implementation of the National Guidelines on Self-Care for Reproductive and Maternal Health as adapted from the WHO Consolidated Guideline on Self-Care Interventions for Health. The National Self-Care Network has supported the dissemination of the guideline to 23 out of the 36 states, of which Pathfinder International led the process in 3 states, starting with advocacy to the state stakeholders hosted by the state ministries of health and orientation on self-care with all local government area maternal and child health coordinators. The network has also supported the development of the self-care advocacy package, the demand generation strategy for self-care, and recently outlined an annual operational plan to coordinate efforts. Some of the challenges faced with self-care include commodity availability, data integration, and securing funding for the program. These are being addressed through efforts of the National Self-Care Network to integrate self-care into states' annual operational plans and advocacy activities by the Self-Care Advocacy Network. Thank you.
My name is Ijoma Nwankwo from the Pharmaceutical Society of Nigeria Foundation. Our work around self-care has led to some milestones, which include the review of the essential medicines list, which saw the inclusion of DMPA-SC as a driver of self-care, and also the review of the National Task Shifting Task Sharing Policy, which has self-care embedded through the documents. We also secured waivers from the state governments and the regulator of the private sector providers, that's the Pharmacy Council of Nigeria, to allow the community pharmacists and the patent and proprietary medicine vendors to be able to provide quality family planning services. One of the key challenges that we've encountered in the work is the delay and the length of time it takes to review policies due to government bureaucracies. Also, the bias of the policymakers and not being able to grasp the concept of self-care and self-medication. Thank you.
Hello, my name is Tonte Ibrahim, Executive Director of White Ribbon Alliance Nigeria. The White Ribbon Alliance have contributed to pioneering the development and implementation of the National Self-Care Guidelines and other policies such as the Demand Generation Strategy across the country. In collaboration with the Federal Ministry of Health and other key stakeholders, we have been able to promote self-care interventions in Nigeria through a partnership of self-care stakeholders and the Self-Care Advocacy Network, SAN. One of the biggest challenges we have faced so far is that the National Self-Care Guideline is not domesticated in some states in the country, and this means that there is a risk for women in such areas to go without access to self-care commodities. There is also the issue of limited funding for self-care intervention in Nigeria. Thank you.
Hello, my name is Anne Ammerdorfer. I am the Research Manager of Concept Foundation. Allowing the option to self-administer contraceptives can increase its access and reduce unintended pregnancies. However, country regulations sometimes discourage self-administration, for example by requiring prescriptions. We investigated the presence of national regulatory procedures to reclassify contraceptives from prescription only to being available over the counter in 30 diverse countries. Almost 60% of the countries and 85% of the lower middle income countries did not have such formal procedures. Concept Foundation published several recommendations for countries. Adopt formal regulatory procedures for reclassification. Standardize these procedures across countries, and countries that do not have formal classifications for over-the-counter products could introduce this category as a first step. Such actions could increase women's choice of contraception, assure their quality, and prevent unintended pregnancies.
Hello, good evening. My name is Dr. Dina Amongin, and I am a lecturer at Makerere University School of Public Health. As a country, we are developing the national guidelines for self-care in SRH. Now, our engagement in R4S has actually been able to help us, fast track development of these guidelines, and importantly, contribute in the self-care expert working group that we are taking part in. We've been able to actually incorporate in our findings from the research that we are doing into development of these guidelines. And we actually are very optimistic, and we look forward to much more contribution towards the national guidelines and being able to support the Ministry of Health advance self-care in Uganda. Thank you.
Under the CIP and FP 2020 and now FP 2030, self-care has been promoted as a significant prevention, especially during the COVID and flood emergency due to climate change. Under self-care, we have introduced DMPAS, known as CNRPS, through wider assisted education as well as self-education. Emergency capacity, ECP, was also provided facilities and community workers for distribution. Therefore, self-care has become a significant approach in public health and family planning initiatives due to overall interventions across different partners and departments coordinated by state. The contraceptive rate of SIN has increased 4 percentage points in rural parts of rounds.
My name is Pamela Adhiambo. I am the Advocacy Officer at Reproductive Health Network Kenya. A challenge we have faced in regards to self-care is that individuals here in Kenya have been practicing self-care for a very long time in an attempt to promote their sexual reproductive health, but there hasn't been a legal framework that appropriated on how self-care should be done or guided the self-care practice. So we are really happy that we have been able to domesticate the WHO self-care guidelines, and we now have a self-care guideline that focuses on reproductive health, and this is going to be a guide for partners, for healthcare providers who are initiators of self-care, for even individuals who are going to practice self-care, so that they know to what extent they practice self-care, at what point they need a health professional, and even who are the agents who are going to support them in their self-care journey.
Hello, I'm Emma Collingbourne from Avert. At Avert, we create digital content and platforms that build health literacy on HIV and sexual health. We believe that health literacy sits at the foundation of self-care. One of the challenges we aim to address is equipping young people to be able to engage in their own self-care around HIV and sexual health. Avert has developed Be in the Know, a new digital brand offering fun, fresh and sex-positive content for young people via website and social media. Be in the Know is already reaching and engaging millions of young people in sub-Saharan Africa and globally. Through co-creation, we ensure that our content is relevant, engaging and fulfills the needs of young people. Our content is accessible and actionable. It encourages open discussions and increases our audience's skills and confidence to be active partners in their own care.
Thank you very much. Dr. Akoto Anthony is my name, Head of Division Policy Planning and Healthcare Financing, and I wish to take this opportunity to really thank Reproductive Health Network Kenya for the partnership that we are currently having with Bungoma County. We've been privileged to have conversations around sexual and reproductive health rights, and now moving from policy to action, and we are asking now our stakeholders, partners, healthcare workers, to come on board and support dissemination, access of this portfolio and information to members of our community.
Action Research and Training for Health, located in Rajasthan, India, facilitates self-care for reproductive health in rural and tribal areas where education levels are low and women are restricted by customs and traditions. Women can purchase pregnancy tests from a community health entrepreneur at prices lower than the market rate. The entrepreneur supports the woman in self-testing. This test has been named Swayam, meaning on my own, in Hindi. This term and the test brings a sense of agency to the woman and helps her decide in time on future options like contraception, pregnancy care, or abortion. The product's envelope pictorially explains the process of conducting the test and mentions Earth's helpline number, which the woman can call in case of any questions. Women having smartphones can also view an educational video on self-testing. Community health entrepreneurs over the years have sold over 72,000 tests, with a major increase during the COVID pandemic. We conducted surveys which revealed that 17.5% young married women at baseline and 26.7% in the end line had used the test on their own. We are trying to understand why most women rely on someone else to conduct the test and hope to continue this work, which enables women to take decisions in a timely manner based on their reproductive intentions.